Honorable attendance, allow me to present our work entitled Dermoscopy of Hemangiomas. We will start with an introduction, patients and methods, results, discussion before concluding. As an introduction, infantile hemangioma is the most common pediatric vascular tumor. It has a female preponderance. Diagnosis is usually clinical, but dermoscopy can provide the diagnosis and may be very useful for assessing vascular structures. The aim of our work was to describe the dermoscopy features of infantile hemangiomas and to investigate the role of dermoscopy in identifying hemangioma type, monitoring lesions, and evaluating treatment efficacy. We conducted a retrospective and descriptive study on the period of 10 years taking place in our dermatology department. We included all patients under 18 years with a diagnosis of infantile hemangioma who underwent a dermoscopic examination. Moving to results, we collected 32 patients divided into 22 girls and 10 boys. The mean age of patients was 21 months and the total number of lesions was 103 with an average size of 3.6 centimeters. All hemangiomas were localized except two segmental hemangiomas of the face, a miliary hemangiomatosis and a multifocal sporticoid hemangioma. The locations of hemangioma by decreasing frequency were cervicofacial, followed by the trunk, the lower limb, the scalp, the upper limb, and the buttock and the genital area. The hemangiomas were most commonly superficial in 85%, followed by mixed hemangiomas and then deep hemangiomas. In dermoscopy, the most common structures was lacunae in 81%. They were mostly red in 77%, purplish red or rarely black. Here are some dermoscopic images showing the different types of lacunae. The background was commonly red in 82%, pink or purplish, as seen in these pictures. There were no vessels in almost half of the cases, and the vascular structures found in decreasing order were globular vessels in 22%, telangiectasia, glomerular, wavy, and hairpin vessels. Then linear dilated blood vessels, corkscrew vessels, spermatozoa-like vessels, gamma-shaped, arborizing, reticular vessels, and finally radial vessels. Here are some pictures of the most common vessels found in our study. On the left, we have globular vessels in blue and gamma-shaped vessels in a black circle. On the right, wavy vessels and some telangiectasia. On the left, a hairpin vessel, and on the right, a strawberry pattern with some dilated vessel boxed in yellow. Here we have corkscrew vessels, glomerular vessels in green, and telangiectasia pointed in red arrow. Here we have spermatozoa-like vessels on the left and gamma-shaped vessels on the right, arborizing vessels, reticular vessels, and radial vessels. The lacunae were more frequent in superficial hemangiomas, and we noted the preponderance of vessels in deep hemangiomas. Other dermoscopic features were white structureless areas, white reticular pattern, strawberry pattern, ulceration, yellowish scales, and whitish scales. Moving to the discussion part. Firstly, dermoscopy allows the correct diagnosis, especially when the arrangement of lesions is not suggestive as seen in the picture. It allows subclassifying hemangiomas by analyzing lacunae and vessels. Histologically, lacunae correspond to large dilated vascular spaces in the superficial dermis. Then we noted that lacunae are more frequently present in superficial hemangiomas than mixed and deep ones. In contrast, vessels, especially arborizing and linear dilated vessels, tend to be present in deep or mixed forms more than in superficial hemangiomas. This fact was confirmed by 3 studies in which deep vascular patterns, such as dilated vessels, were absent in superficial type, while lacunae were present. Dermoscopy can also assess the treatment response. Here is a patient with a segmental hemangioma of the face after 9 days of oral beta blockers. Clinically, we had no visible results, but in this dermoscopy, we had already some milky areas of central regression. After 6 months, lacunae disappeared with the persistence of few dilated vessels. Then, after 1 year, only some thin vessels remained. In conclusion, dermoscopy is an invasive tool that allows a diagnosis, assess evolution phases, detect early signs of complications, and evaluate treatment efficacy. Our study confirms that the deep hemangioma shows more vessels than lacunae, superficial hemangioma more lacunae than vessels, and the mixed hemangioma shows both lacunae and vascular structures. Thank you for your attention.